In this PowerPoint, we'll discuss about the histology of the spleen, covering the competency EN 70.2. The learning objectives are: describe the microscopic structure of the spleen, identify spleen under microscope, and discuss the microcirculation within the spleen. The spleen, it is the largest lymphoid organ present in the upper part of the abdominal cavity, that is the left hypochondrium, which is behind the stomach. It is completely covered by the peritoneum. Normally, it is blood-forming organ in fetal life and blood-destroying organ in postnatal life. That is, it is also called as the graveyard of the orifices. It serves as a reservoir of the blood. It is the only lymphoid organ that primarily filters the blood from blood-borne antigens and microorganisms. It is a site for immune responses to blood-borne infections. Now, what are the histological components of the spleen or structure? It consists of connective tissue framework and the parenchyma. In the connective tissue framework, we are having the capsule, trabeculae, and the reticularstroma or fibers. Whereas the parenchyma, it includes the white pulp, that is the typical lymphoid tissue, and the red pulp, that is the atypical lymphoid tissue. Now let us come to the capsule. Capsule, it covers the spleen completely. It lies deep to the mesothelium, that is the peritoneal covering. The capsule of the spleen, it consists of irregular, dense fibroelastic tissue where elastic fibers are in abundance. The connective tissue of the capsule, it also contains the contractile cells. They are called as the myofibroblasts. The smooth muscle fibers are more in some mammals, and the contraction of these smooth muscles causes pumping of blood from the spleen into the circulation. Let us come to the trabeculae. Trabeculae, they are the extensions from the capsule and extend into the substance of the spleen, which forms a network. They are thick and robust. The composition of the trabeculae, it consists of, similar to that of the capsule, that is fibrous tissue in which elastic fibers are abundant and smooth muscle fibers are also present. They carry the trabecular vessels, which are branches of the splenic vessels. The reticularstroma, it is made up of reticular fibers and associated phagocytic reticular cells, forming a meshwork throughout the organ. Here in this figure, you can see these thread-like structures, and they are the reticular fibers, whereas the cells, these are the reticular cells, and they support the parenchyma. Parenchyma, it is on the basis of the color of the fresh section. It shows two different regions, that is the rounded white or grey pulp, and which forms the immune component of the spleen, that is the lymphocytes are present. Whereas the other, it is a dark red area, and this dark red area, it is also called as the red pulp of the spleen. Microscopically, the white pulp, it is made up of aggregations of the lymphoid tissue around a small artery, that is the arteriole. This arteriole is the branch of the trabecular artery that leaves the trabeculum and enters into the pulp of the spleen. On entering into the pulp of the spleen, this trabecular artery, it is surrounded by lymphoid tissue, and this lymphoid tissue, it is called as periarterial lymphatic sheath, that is PALS. This periarterial lymphatic sheath, they are the cylindrical masses that run along the axis of the central artery or the white pulp artery. In the cross section, this periarterial lymphatic sheath, it looks like a mass of the lymphoid tissue surrounding the central artery, and they contain the T cells. Hence, it forms the thymus dependent zone of the spleen. At some places along the course of the periarterial lymphatic sheath, there is B cell proliferation, and on exposure to antigen and develop the germinal center. And this presence of this germinal center, it pushes the arteries toward the periphery, and so it is called as the eccentric arteriole because of the formation of this germinal center. Such nodules are called as splenic nodules or Malpighian corpuscles. The white pulp, it is surrounded by the red pulp, which forms a major part of the splenic parenchyma, and it consists of splenic sinusoids and the splenic cords, also cords of the Billroth. These cords of the Billroth, they are irregular anastomosing cords, dense network of reticular fibers that contain numerous erythrocytes, lymphocytes, plasma cells, macrophages, and other granulocytes. These cords of Billroth, they are separated from each other by sinusoids, and these sinusoids, they are called as splenic sinuses or splenic sinusoids. They have wide lumen. They are lined by elongated endothelial cells that lie parallel to the longitudinal axis of the sinusoids. The basal lamina of the sinusoids, it is discontinuous, and the adjacent endothelial cells are separated by large intercellular space that allows the blood to pass through it. These walls of the splenic sinusoid does not have any pericytes or smooth muscle cells. As the blood cells are present within the sinusoids as well as in the splenic cords, so it becomes difficult to differentiate between the splenic sinusoids. Structure of these venous sinuses, it can be compared to the tall wooden barrels with both the ends open and the endothelial cells being represented by the wooden staves. Hence, they are described as stave cells. Externally, the sinuses, they are covered by or encircled by reticular fibers in a transverse section, and they are in the direction like a steel bands holding together the staves of the wooden barrel. Since the space or the gap between the endothelial cells is between 2 to 3 micrometer in diameter, so only flexible cells are able to pass easily to and from the cords of the sinuses. A reduction in the flexibility of the erythrocytes after 128 days seems to be signal for the destruction of these cells. Then comes the marginal zone. The marginal zone, we can describe it between the red pulp and the white pulp. The lymphatic nodule or the white pulp, they are surrounded by immunological active zone containing many macrophages, antigen presenting cells, and few T lymphocytes and blood sinuses. This functional zone between the white pulp and the red pulp is called as the marginal zone, or we can also say it as the functional marginal zone, and the function of it, it is the antigen presenting cells bring circulating antigens in contact with the lymphocytes in spleen and induce required immune response. To understand the histology, we should know the splenic circulation. So the splenic circulation, it is that is the blood supply, it is through splenic artery. This splenic artery enters through the hilum. As it enters through the hilum, it divides to form the trabecular arteries. These trabecular arteries, they run in the trabeculae of the spleen, and they give, from these trabecular arteries, they give rise to numerous central arterioles. The central artery or the arteriole, it leaves the periarterial lymphatic sheath of the white pulp and enters into the red pulp, where it divides to form straight, numerous peninsular arterioles. Some of the peninsular arterioles, it may show the thickening of the wall due to the aggregation of the macrophages, reticular cells, and the lymphoid cells. These thickenings, they are called as ellipsoids. The peninsullae, they terminate as the arterial capillaries. The mode of the termination of the peninsular arterioles in the red pulp, it is controversial. We are having the two theories that are proposed to explain the mode of the termination of the arterial capillaries. of the peninsula into the venous sinus of the red pulp, and it is the open and the closed circulation in the spleen. Let us talk about the closed circulation theory. According to this theory, blood passes directly from the arterial capillaries into the splenic venous sinuses of the red pulp, that is the vascular system, and it is continuous or closed. From there, the blood enters the red pulp veins, which join together to form the trabecular vein, and this trabecular vein it opens into the splenic vein that leaves the spleen through the hilum. Whereas in open circulation, the blood passes from the arterial capillary of the peninsula into the cords of the bilirubin, and from there into the sinuses through the spaces between the endothelial cells. Splenic sinusoids, they are lined by elongated banana-shaped cells, and they are called as stave cells. Cytoplasmic fibrils of the stave cells helps in opening and closing of the intercellular gaps, and thus play a major role in trapping of the aged and the damaged cells. In this process, the non-flexible old erythrocytes are retained in the cords and are then engulfed by the macrophages. An important thing to note over here is that in humans, only open circulation is present, whereas in case of dogs and rats, closed circulation is present. There is one more compromised theory about the splenic circulation, which states that the splenic circulation it is closed in contracted spleen and open in the distended spleen. What are the functions of the spleen? Spleen, it performs the immune system function as well as the hemopoietic function. That is, spleen activates the lymphocytes by using antigen-presenting cells and induces the immune response. It is a site for proliferation of the T and the B lymphocytes. It helps in the filtration of the blood, that is, filters the blood from antigens, microorganisms, aged platelets, and aged and abnormal RBCs. It is also the reservoir of blood in some mammals. It acts as an hemopoietic organ in fetal life. It has a role in phagocytosis of old RBCs. Macrophages of the spleen remove iron from the hemoglobin of the aged RBCs, which is reused for the synthesis of hemoglobin in bone marrow. Let us talk about some clinical conditions associated with the spleen. One of them is the splenomegaly, which is the enlargement of the spleen. It can be because of different reasons, that could be because of immunological reasons or the hematological reasons, such as presence of abnormal RBCs in the conditions like thalassemia and sickle cell anemia. We are having certain immune disorders and infections such as malaria infection, splenic abscess, typhoid fever, or rheumatoid arthritis. In certain cancerous conditions like leukemia, again we can see the enlargement of the spleen, obstruction to the venous blood, that is cirrhosis of the liver, and obstruction of the portal vein. In these conditions, we can see the enlargement of the spleen, that is called as splenomegaly. There is one more condition, that is splenectomy. What do we mean by splenectomy? It is a surgical removal of the spleen. It is indicated in certain conditions when there is injury to the spleen, certain cancerous conditions like leukemia, severe hemolytic anemias, and so on. Patients after splenectomy they do not respond properly to the infections, but even after splenectomy, one can survive. So it is not considered a very important organ for the survival. This is a just overview of what we have read till now. That is spleen. It consists of trabeculae and capsule, parenchyma, and the marginal zone. In capsule and trabecular, we are having it is covered by dense connective tissue, contains myofibroblasts. Trabeculae arise from capsule and enter into the parenchyma. Let us come to the parenchyma having the white pulp, that is a darkly stained or basophilic central arterioles. They are surrounded by periarterial lymphatic sheath made up of the B cells, whereas splenic nodules or malpighian corpuscles made up of B cells, which are having a germinal center and eccentric arteriole. The parenchyma, it is having the red pulp, which is lightly stained, more eosinophilic, contains the pods of bilirubin made up of RBCs, lymphocytes, macrophages, and plasma cells, and splenic sinusoids lined by enlarged endothelial cells stem cells and filled with the RBCs. Marginal zone, it lies between the white and the red pulp, contains numerous antigen-presenting cells. What is the function of the spleen? Multiplication and activation of the lymphocytes, phagocytosis of old and damaged RBCs, also called as the graveyard of the RBCs, and hemopoietic function in the fetal life. Thank you very much.